Top 20 Healthcare Assistant Interview Questions and Answers. Healthcare assistants play a vital role in supporting patients and healthcare professionals in various medical settings. If you are preparing for a healthcare assistant interview, being ready with strong answers can boost your chances of success. In this guide, we cover the top 20 healthcare assistant interview questions with detailed answers to help you stand out and confidently secure your desired role. 1. Why do you want to work as a healthcare assistant? I want to work as a healthcare assistant because I am passionate about helping people and making a positive difference in their lives. I find personal fulfillment in providing care, comfort, and support to those in need. The role also offers opportunities to develop skills, gain valuable healthcare experience, and work as part of a team dedicated to improving patient well-being and quality of life. 2. What qualities are important for a healthcare assistant? Key qualities include compassion, patience, empathy, and strong communication skills. Healthcare assistants must also be reliable, attentive, and able to work well under pressure. The ability to respect confidentiality, follow procedures accurately, and maintain professionalism at all times is crucial. Physical stamina and a positive attitude are also vital in ensuring patients receive the best possible care and feel supported throughout their treatment and recovery process. 3. How would you handle a difficult patient? When handling a difficult patient, I remain calm, patient, and respectful. I listen carefully to their concerns, acknowledging their feelings while maintaining professionalism. Often, showing empathy and explaining procedures clearly can ease their frustration. If necessary, I involve senior staff or the nurse in charge for additional support. My focus is always on ensuring the patient feels heard, respected, and cared for without compromising safety or quality of service. 4. How do you maintain patient confidentiality? Maintaining confidentiality means never sharing patient details with unauthorized people. I ensure records are stored securely and only discuss medical information with relevant healthcare professionals. I avoid speaking about patients in public areas and follow organizational data protection policies. Respecting confidentiality not only protects patients but also builds trust and strengthens professional relationships. I understand that safeguarding privacy is a legal and ethical responsibility in healthcare environments. 5. How would you support a patient's emotional needs? Supporting emotional needs involves listening actively, offering reassurance, and showing empathy. I always treat patients with kindness, respect, and dignity, especially during vulnerable moments. I provide comfort by being approachable and attentive, ensuring they feel valued and understood. Simple acts, like holding a hand, maintaining eye contact, or offering encouragement, can ease stress. I would also inform senior staff if I feel additional emotional support is required. 6. Can you describe your experience in personal care duties? I have experience assisting patients with tasks such as bathing, dressing, feeding, and maintaining personal hygiene. I perform these duties with sensitivity and respect for patient dignity. I also ensure that safety and comfort come first, using proper techniques to prevent discomfort or injury. I believe personal care is more than just physical assistance. It's also about promoting independence, boosting confidence, and ensuring patients feel comfortable and respected at all times. 7. How do you prioritize tasks when caring for multiple patients? I prioritize tasks by assessing patient needs and urgency. For example, I first attend to patients requiring immediate assistance, such as those with mobility challenges or medical needs. I then complete routine tasks, ensuring each patient receives timely care. I also communicate with colleagues to ensure workloads are managed effectively. Time management and flexibility are essential, as priorities can change quickly in a healthcare environment. 8. How would you handle an emergency situation? In an emergency, I stay calm and follow established procedures. My first step is to assess the situation, ensure my safety, and call for immediate assistance from medical staff. I provide basic support within my training, such as helping move patients to safety or providing reassurance. Clear communication with the healthcare team is crucial. I understand that quick, effective responses in emergencies can make a vital difference in outcomes. 9. What motivates you in this role? My motivation comes from making a meaningful difference in people's lives every day. Helping patients feel comfortable, supported, and respected gives me great satisfaction. I am also motivated by the opportunity to work within a healthcare team, continuously learn, and develop my skills. Knowing my role contributes to improving patient care and overall well-being inspires me to perform to the best of my ability. 10. How do you deal with stressful situations at work? I handle stress by staying calm, organized, and focused on solutions. When under pressure, I prioritize tasks, manage my time efficiently, and seek support from colleagues when necessary. I remind myself that maintaining professionalism and composure helps patients feel reassured. Afterward, I reflect on the situation to learn and improve. I also practice self-care outside of work, ensuring I remain balanced, motivated, and resilient in demanding healthcare environments. 11. How do you ensure respect and dignity for patients? Respect and dignity are central to quality care. I always address patients politely, listen to their preferences, and respect their cultural and personal values. I provide care discreetly, protecting their privacy and ensuring comfort during personal tasks. I involve them in decisions about their care whenever possible. Treating patients as individuals and valuing their independence ensures they feel respected, supported, and empowered in the healthcare setting. 12. Can you give an example of teamwork in healthcare? In healthcare, teamwork is essential for patient safety and quality care. For example, while assisting a patient with mobility, I collaborated with nurses and physiotherapists to ensure the patient's safety and progress. We communicated clearly, shared responsibilities, and supported each other to achieve the best outcome. This experience reinforced my belief that effective teamwork enhances efficiency, reduces risks, and provides patients with the best possible support and care. 13. How do you handle a situation where a patient refuses care? If a patient refuses care, I first respect their decision while trying to understand their concerns. I calmly explain the importance of the procedure and address any fears or misunderstandings. If they continue to refuse, I document the situation and inform the nurse or senior staff. My goal is always to balance respect for patient autonomy with ensuring they have the information needed to make an informed choice. 14. How do you manage infection control? I strictly follow infection control procedures, such as regular hand washing, using personal protective equipment, and properly disposing of waste. I clean equipment according to guidelines and ensure the patient environment remains hygienic. I also stay updated on policies and training to reduce risks. Infection control is essential for protecting both patients and staff, and I always remain vigilant in maintaining the highest standards of hygiene and safety. 15. How do you ensure effective communication with patients? I use clear, simple language, maintain eye contact, and listen attentively. I adapt my communication style to meet individual needs, such as speaking slowly for elderly patients or using visual aids if required. I also pay attention to body language and nonverbal cues. Ensuring patients feel understood and valued builds trust, reduces anxiety, and enhances the overall quality of care they receive in the healthcare environment. 16. What would you do if you noticed a colleague not following procedures? If I observed a colleague not following procedures, I would prioritize patient safety by addressing the issue appropriately. Depending on the situation, I might discreetly remind them of the correct procedure. If it was serious, I would escalate the concern to a supervisor or senior staff. It is important to maintain professionalism and ensure standards are upheld, as proper procedures are crucial for patient safety and quality care. 17. How do you handle feedback from supervisors? I view feedback as an opportunity to learn and grow. I listen carefully, ask questions if I need clarification, and apply suggestions to improve my performance. Whether positive or constructive, I appreciate feedback because it helps me develop professionally and deliver better care. I remain open-minded and adaptable, understanding that healthcare is a field where continuous improvement is necessary for both personal and professional growth. 18. How do you support patients with mobility issues? I support patients with mobility issues by using safe handling techniques, ensuring they feel comfortable and secure. I provide encouragement, maintain patience, and respect their pace. I may use aids like wheelchairs, hoists, or walking frames when appropriate. My goal is to promote independence while minimizing risks. I also collaborate with physiotherapists or nurses if additional support is required, always prioritizing patient safety and dignity during movement. 19. How do you stay motivated in repetitive tasks? I stay motivated by focusing on the bigger picture. Each task, no matter how repetitive, contributes to patient comfort and well-being. I remind myself that even small acts, like making a bed or assisting with meals, make a difference in someone's day. I also set personal goals for efficiency and quality, and I find motivation in learning from colleagues and striving to continuously improve my care delivery. 20. Why should we hire you as a healthcare assistant? You should hire me because I am compassionate, reliable, and dedicated to delivering excellent patient care. I have the skills, empathy, and motivation required to support patients effectively while working well within a team. I take pride in maintaining high standards of safety, dignity, and respect. My positive attitude and willingness to learn ensure I can contribute positively to your healthcare team and organization. Preparing for a healthcare assistant interview requires understanding both the practical and emotional aspects of patient care. By practicing these questions and answers, you can demonstrate your compassion, skills, and professionalism to potential employers. Remember, the key to success is showing empathy, strong teamwork, and dedication to patient well-being. Good luck with your interview. You have the potential to make a real difference in healthcare,